Phoenix Home Care and Hospice. I choose Phoenix.
Hello and welcome to another episode of Why It Matters from Phoenix Home Care and Hospice. We are here in Denver, Colorado at Phoenix Home Care, and I'm excited to be here with Anna Sumpmann. Now, Anna is an occupational therapist with Phoenix Home Care, and she's been with us since April. And Anna, welcome. I'm excited to have you.
Thank you for having me.
So you are an occupational therapist. So tell me, what does that mean? What does an occupational therapist do?
Well, an occupation is anything that occupies your time.
Okay.
But generally, we look at self-care, safety in the home. Can you get dressed? Can you bathe yourself? Can you make meals for yourself? Can you manage your own medications so that you are safe at home?
So basically, life skills,
Yes.
life home skills, and you help people be as normal at that as they possibly can be in whatever stage of life they're in.
Whatever their roles are, just to return them to that so that they have a meaningful and fulfilling life.
Wow, you're living our mission. That's awesome. So in that occupational therapy, you have found something that surfaces a lot post-surgery, in chemotherapy treatment, whatever. You have found something that happens to a lot of patients, and you found a way to help them. What is that?
It's lymphedema management. And so
What is lymphedema management?
It's a wide net, just like occupational therapy is, but basically it's swelling management and all different levels of swelling management, whether that is, like you said, after surgery, maybe a knee surgery and their foot swollen, or maybe they've just had a breast reconstruction surgery because of breast cancer, and now their arm is swollen because the lymph nodes have been removed.
Wow. So lymphedema is usually a swelling of a limb, of a leg or an arm.
Yes.
And it totally limits people from having that normal lifestyle in their home.
It can affect their ability to get dressed. It can make them a fall risk, and it really does change, their self-image and the way that other people perceive them.
Sure. So there's a whole self-confidence issue too. So you are actually a lymphedema therapist, correct?
Yes, I am certified.
So what is that? What do you do? How do you help them?
First, take measurements, find out how different is one limb from the other to see, okay, is this more just on one side, or is there a little bit happening on both? And then I do what's called manual lymph drainage, which some people kind of consider a massage, but it's very, very light. The lymphatic system doesn't have its own pump like the vascular system, so it relies on movement and gravity, so that's why when things are swollen, tell people to elevate it.
Okay.
So it's really pushing that fluid to intact lymph nodes to be recirculated around the body.
And then the swelling goes down.
And then usually that's followed by wrapping somehow, so that that area has a chance to kind of recover a little bit and not fill back up right away.
Wow. So lymphedema management and lymphedema therapists, is that a common thing in the home healthcare industry? Does every home healthcare agency have somebody like you?
Certainly not. I used to work in the hospitals and in outpatient clinics, and most of the time people don't get this kind of treatment until they're well enough to go to an outpatient clinic, and some people aren't able to do that for a really long time. So when I got this job with Phoenix, I was really excited that I was able to partner and offer the service to people sooner so that really people aren't suffering.
And they can get in their homes again.
Yes.
Yeah, what a gift. So lymphedema therapists, that sounds like it takes a lot of training and a lot of learning to get to the level that you're at. Is that true?
It was 140 hours of coursework, lots of self-study, and then 9 straight days of 10-hour practicals.
Yeah, actually. Well, we are honored that you're a part of Phoenix Home Care here in Colorado, and I thank you, Anna, for joining us today.
Thank you for having me.
And thank you for joining Why It Matters, a program brought to you by Phoenix Home Care and Hospice that celebrates the moments that life gives us and helps us find our new beginnings. We'll see you next time.
Phoenix Home Care and Hospice. I choose Phoenix.